I'm Bernard Tawfik. I'm a medical oncologist specializes in breast and GI cancer at the University of New Mexico Comprehensive Cancer Center in Albuquerque, New Mexico. What it means to be immunocompromised is that they have an immune system that is not functioning normal. And they may not be functioning normal for a variety of reasons. In cancer itself, it's because A, they have cancer. Cancer in and of itself does compromise your immune system. And then B, they're receiving treatment for that cancer. And treatment for cancer does compromise your immune system either indirectly or directly by weakening your immune system as a side effect of the treatment for the cancer. That's a complex question, and the reason is it depends how recently and what kind of cancer. If someone had, a breast or cancer or lymphoma 10 years ago and they were treated and they didn't have any other problems, then probably not. But if someone's very recently been treated for lung cancer and part of their lung has been removed, or they received radiation to their lung, then it is possible it does. So it's very specific, but mainly think about, have I gotten treatment within the last year? If you're beyond a year, your immune system is probably back to normal. And two, have my lungs taken some sort of insult? And that insult may be a surgery or radiation. If they haven't taken surgery or radiation, then you're probably fine. Oral cancer therapies are very helpful right now because it avoids patients coming into the hospital and the clinic unnecessarily. So it's important to A, keep taking those medicines if your doctors prescribe them, and B, be cognizant of what the side effects of those cancer medicines are. Many of those medicines do cause immunosuppression or low white blood cell count, which are important to fight any virus like COVID-19. That doesn't mean stop taking it. It just means be extra careful washing your hands, extra careful staying inside, extra careful doing social distancing. But again, continue to take those medicines. If you do have the option to do mail order pharmacies or have them sent directly to your house or have someone go pick them up for you, that would be ideal. It depends what kind of cancer. We have some cancers that are slow growing. If you have a slow growing lymphoma or a slow growing solid tumor, then yeah, maybe delaying treatment makes sense. But if you have a very aggressive lymphoma or a pancreatic cancer or a brain cancer, then you probably need to start treatment sooner rather than later. And unfortunately, we don't have a definitive timeline on when this virus pandemic is going to end. We don't know if it's going to go through many waves. So there's not like a set date to start treatment in the future if you do delay. So I think it's a constant discussion between you and your oncologist, and your oncologist will guide you. There are some patients that I'm delaying treatment for, but there are many that I am initiating treatment right now for. So right now, I would recommend not doing screening imaging if at all possible. So I treat a lot of breast cancer, so I'm not doing screening mammograms in my breast cancer survivors because I think the risk from the virus is higher than the risk that we're going to find something right this second. That doesn't mean you get to skip a year or anything. That just means we're delaying until most of the virus has passed and we can safely do screening tests again. Now, every patient is individual, so this is going to be a discussion with you and your oncologist. Very high-risk people, they may really want to do scans, like lung cancer is a very high risk of recurrence. But in other cancers, like breast cancer, like colon cancer, maybe putting off those scans a few months is the right decision.